Welcome back to the Truth About Utilization Management, what every nurse needs to know, presented by Healthcare Nurses Network and Nurses Link Up. You're implementing proactive strategies, documenting carefully, and collaborating effectively. But how do you measure success? How do you truly know if your utilization management efforts are making a difference, beyond just gut feelings? In Episode 9, we tackle top utilization management metrics for nurses. Based on Dr. Nicolas Abella's 9th article, this episode moves beyond tracking data for data's sake. As Dr. Abella points out, it's easy to fall into the vanity metric trap, focusing on numbers that don't lead to real improvement. Get ready to learn about the metrics that actually matter for nurses. James and Emily will discuss Dr. Abella's guide to selecting, tracking, and interpreting key performance indicators, from length of stay and denials to readmissions and documentation quality, transforming numbers into actionable knowledge for continuous improvement. Here are your hosts, James Carter and Emily Ramirez.
Welcome back to the Healthcare Nurses Network. We're so glad you're here with us today as we take it into something that can really make a difference in your nursing career. Utilization management metrics.
It's all about working smarter, not harder, right? And metrics are a really powerful tool to make that happen.
Absolutely. We're all about empowering you with those insights and strategies and the real-world solutions that help you thrive in your careers.
That's what we're here for.
And today, we're really zeroing in on how mastering metrics can be a total game changer in achieving that.
Because so many of you are already dedicated to proactive, documenting thoroughly, collaborating with your colleagues, being amazing advocates for your patients.
You guys are rock stars. We know it.
And that's truly inspiring to see. But today, we want to take it a step further.
Yeah, we want to help you make sure that those efforts are as effective as they can possibly be.
We're going to move beyond just gut feelings and really explore how tracking the right metrics, the ones that truly matter.
Right, the ones that give you that clear, objective picture of how your unit is performing.
Exactly. And how to pinpoint areas where you can make things even better, ultimately elevating patient care and maximizing those precious resources we have.
And we've got a fantastic guide for our journey today. Dr. Nicolas Abella's article, Top Utilization Management Metrics for Nurses, Tracking and Improving Performance.
It's a fantastic resource, really practical and insightful.
So think of this as your toolkit for really understanding, tracking, and interpreting those key metrics. We're going to turn data into actionable insights, the kind that you can use in your everyday practice to make a real difference.
But let's be honest, diving into data can sometimes feel a little overwhelming, right?
A little bit.
There's just so much of it out there, and it's easy to get lost.
It can feel like a data tsunami sometimes.
Exactly. And that's why right up front, we need to talk about what Dr. Abella calls the vanity metric trap. Not all data is created equal, and sometimes focusing on the wrong numbers can actually lead us astray.
Okay, let's unpack that for a minute. What are the key characteristics that make a metric truly effective, truly valuable for nurses like you?
Well, if we look at the work of Giardino and Wadwa, along with Marshall and his colleagues, we can see that a truly effective metric needs to tick a few boxes.
Okay, let's hear them.
First and foremost, it's got to be relevant. It has to be directly connected to our core goals.
Which are?
Providing the best possible patient care, of course, being responsible stewards of our resources, and making sure we're meeting all those regulatory requirements.
So many boxes to tick.
Absolutely, but if a metric doesn't speak to those areas, if it doesn't give us insights into how we're doing in those areas, it's just noise.
It's just clutter. Yeah.
Exactly, and that's not helpful for anyone.
What else makes a metric really useful for our listeners?
It needs to be actionable. You should be able to actually use the information it gives you to make changes, to refine your processes, and ultimately to improve patient outcomes.
It's got to have real-world application.
Precisely. If the data doesn't point towards concrete steps you can take, then what's the point of collecting it, right?
It needs to be more than just numbers on a page.
Absolutely.
Yeah.
And of course, it also needs to be measurable.
So we can actually track it over time.
Exactly. Quantifiable and trackable. This lets you see trends, compare different data points, and assess the impact of any changes you implement.
It's like measuring your progress, right?
Exactly. And speaking of understanding, the metric needs to be understandable too.
So not just for data scientists or statisticians.
Right. Nurses and nurse leaders, everyone on the front lines needs to be able to grasp what the metric is telling them without needing a PhD in statistics.
If it's too complex to understand, it's not going to be very helpful, is it?
Not at all. And last but not least, timeliness. The data needs to be available frequently enough so that you can actually act on it, intervene proactively.
Oh, so it's not helpful if you only get a report once a year.
No, not at all. Waiting months for a report means you've missed the opportunity to make those timely adjustments that can really make a difference for your patients.
So it's about being proactive, not reactive.
Precisely. And as Marshall and his team highlighted, getting fixated on the wrong metrics, those vanity metrics, can actually be a huge drain on your time and resources.
And even worse, lead to inaccurate conclusions about how your unit is actually performing.
Exactly. And that's something we definitely want to avoid.
All right, so we know what makes a good metric. Let's get specific now. What are some of the key metrics that nurses and nurse leaders should be focusing on?
Dr. Abella breaks these down into really helpful categories. So let's start with length of stay, or LOS metrics.
LOS metrics. Okay, tell me more.
The first one up is average length of stay, also known as ALOS.
ALOS, I've heard of that one. What exactly does that tell us?
Basically, it's the average number of days patients stay hospitalized for a specific diagnosis or procedure.
Okay, that makes sense.
And Shanmugam's research highlights that tracking your unit's ALOS and then comparing it against benchmarks can be really eye-opening.
Benchmarks meaning?
National averages, for example, or perhaps your own hospital's internal targets.
So you can see how you stack up against others.
Exactly. And this comparison can really help you see where you might be able to improve efficiency.
So like a consistently high ALOS for a certain condition could signal that there are delays somewhere in the treatment pathway.
Absolutely. And those delays might actually be impacting patient recovery time.
That's a really important insight.
It is. And it's something that we often don't realize until we start tracking the data.
So how might different nursing roles use this ALOS information in their daily work? Can you give us some examples?
Of course. For you, as a bedside nurse, you might notice a pattern.
Like what kind of pattern?
Perhaps patients on your unit with a particular diagnosis consistently seem to have longer stays compared to what you hear from colleagues on other units. And simply bringing that observation to your nurse manager's attention can spark a really valuable conversation.
It could lead to a closer look at the care protocols on your unit.
Exactly. And it shows how those direct observations you make at the bedside are so valuable.
They really are. What about a nurse leader, like a nurse manager? How can they use ALOS data?
A nurse manager can take a more proactive approach, tracking ALOS for key diagnoses on their unit over time. They can look for trends. Are stays getting longer? Are they consistently above the benchmark?
So they're looking for those red flags.
Exactly. And once they've identified those trends, they can then implement targeted strategies to address them.
What kinds of strategies are we talking about?
It could involve things like refining discharge planning processes or standardizing care pathways for certain patient groups to make those transitions smoother and more efficient.
Okay, so that's at the unit level. What about at a higher level, say for a chief nursing officer, CNO? How is ALOS relevant to their role?
At the CNO level, they're likely monitoring ALOS across the entire hospital system, taking that big picture view. They might set overall improvement targets for specific diagnoses or patient populations, and then work with individual unit leaders to develop and implement the changes needed to meet those goals.
So they're setting the goals and providing the support for those unit leaders to achieve those goals.
Precisely. They're playing that crucial leadership role in driving those system-wide improvements.
All right. Another important LOS metric that Dr. Abella talks about is geometric mean length of stay, or GMLOS.
Another one to add to our vocabulary.
Right. So how does this differ from ALOS, and why should our listeners care about it?
That's a great question. So while ALOS gives us a simple average, GMLOS is another way to measure that typical length of stay, but it's less swayed by those few patients who have exceptionally long stays.
Oh, so those outliers who might skew the average.
Exactly. Think of it like this. If you have a few patients with very long hospitalizations, it can make your ALOS look higher than it really is for most patients.
I see.
GMLOS gives you a more typical picture, a more realistic representation of the central tendency of patient stays for those conditions.
Okay, so it's another way to get a more nuanced view of the data.
Exactly. It's another valuable data point to have when you're comparing against those expected durations.
So how might nurses use this GMLOS information on the front lines?
Well, for you as a bedside nurse, being aware of whether a patient's current length of stay is approaching the GMLOS for their condition can be really helpful.
How so?
It might prompt you to start thinking proactively about any potential roadblocks to discharge and making sure all the necessary steps are being taken in a timely manner.
So it's like anticipating potential problems before they arise.
Exactly. It's all about being proactive and advocating for that smooth transition for your patient.
What about for a nurse leader? How could they use GMLOS?
A nurse manager could review weekly GMLOS data for their unit, looking for any patterns or potential bottlenecks.
So they're looking for any recurring issues that might be hindering timely discharges.
Precisely. And that allows them to address those issues head-on, proactively.
And for the CNO, where does GMLOS fit into their broader perspective?
Similar to ALOS, the CNO would monitor GMLOS across the entire hospital. This gives them a broader understanding of length of stay patterns and helps them spot any major deviations from those expected durations.
So they can see if there are any systemic issues that need to be addressed.
Exactly. And that's so important for ensuring efficient and effective care across the entire organization.
Okay, the next LOS metric is something that might seem pretty simple on the surface, but can actually have a surprisingly big impact.
Oh, I know where you're going with this.
A discharge before noon. Why is this such a big deal?
It might sound like a small thing, but the timing of discharge can really create a ripple effect
A ripple effect on what?
on the efficiency of a hospital. Getting patients discharged earlier in the day frees up beds sooner, which means you can admit new patients more quickly.
It keeps things moving.
Exactly. It's like a well-oiled machine when those discharges happen earlier in the day.
So what's the role of the bedside nurse in making discharge before noon a reality?
Well, one really important thing you can do as a bedside nurse is to prioritize discharge teaching for patients who are expected to go home the next day.
Getting a head start on that education.
Exactly. By getting that education completed in advance, you're really setting the stage for a smooth discharge process on the day itself.
So it's all about being proactive and organized.
Absolutely. And it can make a world of difference.
How can a nurse leader encourage and support those earlier discharges?
A nurse manager can set clear, achievable unit goals for the percentage of patients discharged before noon. It gives the team something concrete to work towards.
It's like a friendly competition, right?
In a way, yes. And it allows everyone to track their progress and see how their efforts are paying off.
And at the CNO level, what can they do to influence this metric?
They can take a broader approach, developing hospital-wide policies or even implementing incentives to increase those early discharges.
So they're looking at the big picture.
Exactly. They might look at processes across different departments, like pharmacy or transportation, to make sure that discharge process is as coordinated and efficient as possible.
It's all about collaboration and communication.
Right, absolutely. It takes a team effort to make those early discharges happen smoothly.
All right, let's move on to another really critical category of metrics, one that has huge implications for hospital finances and potentially for patient care as well.
I'm ready. What is it?
Denial rates. What can you tell us about those?
Oh, denial rates, they can be a real headache.
I bet.
But they also give us crucial insights into potential problems we might be having
Problem like?
with our documentation, coding practices, or whether the care we're providing is actually lining up with what insurance payers consider medically necessary.
Oh, so there's a lot that can go wrong there.
There is, unfortunately. But Dr. Abella breaks down several key denial rate metrics that every nurse should be aware of.
Okay, let's break those down. First up, we have the overall denial rate. What does that tell us?
That's the simplest one. It's the percentage of claims that your hospital submits that end up being denied by insurance payers.
So it's like your overall batting average.
In a way, yes. It gives you that general overview of how often you're running into payment issues.
Not a number you want to see going up.
Definitely not. And then there's the denial rate by payer.
Okay, why is it important to look at denial rates for specific insurance plans?
Because you might find that you have much higher denial rates with certain plans compared to others.
Interesting.
It could be due to different pre-authorization requirements or just how that particular plan interprets medical necessity guidelines.
Like Bernstein and his colleagues found in their research.
Exactly. And identifying those patterns lets you focus your efforts and your education where they're most needed.
You can tailor your approach to each payer.
Absolutely. It makes your efforts much more effective. Then there's denial rate by diagnosis or procedure.
What can that metric tell us?
This one helps you pinpoint specific medical conditions or procedures that are frequently being denied.
So you can see where the problems are cropping up.
Exactly. If you see high denial rates for certain diagnoses or procedures, it might signal a need for more focused education for your staff.
Education on what, specifically?
On the specific documentation requirements for that condition or procedure, or perhaps a review of the medical necessity criteria for those services.
So you're making sure everyone is on the same page.
Precisely. And that can really help reduce denials.
What about denial rate by reason? How does that help us?
This one gives you even more specific and actionable information.
How so?
By categorizing denials based on the reason the payer gave, you get to the root of the problem.
So like, Was it a lack of documented medical necessity, incomplete documentation, or maybe coding errors?
Exactly. Like Sarkar and his team discuss in their research.
Right, so you can target your interventions and process improvements more effectively.
Precisely. And finally, we have denial rate by practitioner.
Okay, I can see how that might be useful, but it also sounds like it needs to be handled with some sensitivity.
You're absolutely right, it does. But it can be a valuable tool for identifying if any individuals need additional support.
Like if a particular doctor consistently has higher denial rates, it might signal a need for more training or resources.
Right. Maybe they need some extra help with documentation or coding best practices.
It's about supporting them to be successful.
Exactly. It's not about pointing fingers or placing blame.
All right, let's bring this back to our listeners. How do nurses at different levels contribute to and impact these various denial rate metrics?
Well, starting with the bedside nurse, you have a tremendous impact on all of these metrics through your documentation.
Documentation is key. We hear that all the time.
It really is. The details you capture in the patient's chart are what justify the medical necessity of the services provided.
So without that solid documentation, denials are much more likely.
It's like building a house on a weak foundation. It's not going to stand up to scrutiny.
What about nurse leaders? What's their role in managing denial rates?
A nurse manager plays a crucial role in monitoring denial rates specifically for their unit. They can then work closely with case managers and physicians to investigate any recurring issues they're seeing.
So it's a collaborative effort to find solutions.
Absolutely. It's about teamwork and communication.
And what about the CNO? How do they approach denial management at a higher level?
A common strategy is to establish a dedicated denial management committee, a team of experts who can analyze denial trends across the entire hospital.
So they can see those big picture patterns.
Exactly. They can identify systemic issues and develop proactive organization-wide strategies to prevent those denials in the first place.
It's about taking a proactive, data-driven approach.
Absolutely. It's about working smarter, not harder.
Okay, let's talk about another really important area that speaks to the quality and continuity of patient care.
I'm listening. What is it?
Readmission rates, particularly the 30-day readmission rate. Why is this metric so important?
It's a really crucial measure because it gives us insights into how well we're doing at transitioning patients back to the community.
So it's not just about getting them out of the hospital door, it's about making sure they stay healthy once they're home.
Exactly. And a high readmission rate can often signal that there might be some issues with our discharge planning process or the education we're providing to patients before they leave.
Or maybe a lack of coordination with their care team once they're back home.
Exactly. It's all about ensuring that continuum of care. And as Hugh and his colleagues highlight in their research, it's crucial to look at all those different aspects.
So what can a bedside nurse do to help influence this important metric?
As a bedside nurse, you're in a unique position to identify patients who might be at a higher risk for readmission.
So you're on the front line seeing those patients every day.
Exactly. And by recognizing those risk factors early on, you can proactively work with the entire team.
The team being.
Social workers, case managers, physicians, everyone involved in the patient's care.
So it's a team effort to put strategies in place.
Absolutely. And the goal is to mitigate those risks before the patient is even discharged.
What kinds of strategies are we talking about?
It could involve things like making sure the patient has a clear understanding of their medications, making sure they have those follow-up appointments scheduled, and teaching them about any warning signs to watch out for.
So it's about empowering them to take control of their health.
Exactly. It's about giving them the tools and the knowledge they need to succeed.
What about nurse leaders? How do they track and address readmission rates?
A nurse manager would be tracking readmission rates for their specific unit, looking for any trends or patterns.
So if they see a consistently high rate, they know there's a problem.
Right. And that prompts them to implement targeted strategies to improve that discharge planning process.
What kinds of strategies are we talking about at the unit level?
It could be anything from enhancing patient education materials to improving communication with outpatient providers, or even setting up post-discharge follow-up calls.
So they're really trying to close those gaps in care.
Exactly. It's about ensuring a seamless transition for those patients.
And what about the CNO? What's their role in tackling readmission rates across the organization?
They typically set those hospital-wide goals for reducing readmissions.
Those big, ambitious goals.
Exactly. And to achieve those goals, they might need to allocate resources to support specific initiatives.
Like what kind of initiatives?
Things like enhanced discharge planning programs, better patient education resources, or even developing robust post-discharge follow-up care programs.
So they're providing the resources and the infrastructure to support those efforts.
Exactly. It takes a system-wide approach to really make a dent in those readmission rates.
All right, let's shift gears a little bit and talk about observation versus inpatient status.
Oh, this is a good one.
It can be a little confusing, right? Why is it so important to make sure patients are in the correct status?
It really boils down to ensuring that patients are receiving the most appropriate level of care.
Right, because observation status and inpatient admission have different criteria, right?
Exactly. And it also has financial implications for both the patient and the hospital.
Oh, right, because it affects how their care is billed.
Exactly. So monitoring the observation rate, which is the percentage of patients placed in observation versus inpatient, can help us make sure we're making the right decisions for our patients and our organizations.
So we're being good stewards of our resources while also providing the best care possible.
Precisely. It's about finding that balance.
So how can a bedside nurse contribute to making sure patients are in the right status?
Having a really strong understanding of the criteria that differentiate observation status from inpatient admission is key.
Right, because there are some subtle nuances there.
There are, and if, based on your clinical assessment of the patient, you think the initial level of care order might not be right, don't hesitate to speak up.
So advocate for your patient.
Exactly. Providing that clear and well-documented rationale for a potential change in status can really make a difference.
You're using your expertise and your judgment to advocate for the best outcome for your patient.
Precisely. It's all about being that patient advocate.
What can nurse leaders do to support their staff in this area?
Nurse managers really need to make sure their nursing staff is well educated on the criteria for observation status versus inpatient admission.
So providing that ongoing education and support.
Exactly. Maybe regular training sessions, access to updated guidelines, and really fostering an environment where nurses feel comfortable raising questions or concerns.
It's about creating that culture of open communication.
Absolutely. It's crucial for ensuring we're making the best decisions for our patients.
And what about at the CNO level? What kinds of policies or initiatives might they oversee related to patient status?
They might be involved in approving and implementing hospital-wide policies that aim to improve the accuracy of those initial level of care assignments.
So they're looking at the system as a whole.
Exactly. They might provide clearer guidelines, implement decision support tools in the EHR, or establish processes for regularly reviewing patient status.
So they're putting those safeguards in place to minimize errors.
Precisely. It's all about continuous improvement.
We've covered a lot of ground already. Let's move on to documentation quality metrics. We talked about the importance of documentation for denial rates, but what other aspects of documentation quality are important?
Documentation is truly the foundation for so much of what we do.
I feel like we're always talking about documentation.
It's that important. And Dr. Abella highlights a few key metrics here. First, we have the documentation completion rate.
Okay, tell me about that one.
That looks at the percentage of patient charts that have all the necessary information.
All the information.
Complete and accurate documentation that meets all those requirements for medical necessity and accurate coding.
So no missing pieces.
Exactly. And then there's documentation timeliness, which looks at how quickly after a patient encounter that documentation is finalized.
So it's not just about completeness, it's also about timeliness.
Absolutely. And there might also be specific data points within the documentation itself that are important to track. Things like the inclusion of certain assessments or interventions, just to make sure we're capturing all the essential details.
So for our listeners out there, the bedside nurses, what's the main takeaway regarding documentation quality metrics?
The bottom line is that you need to provide timely and thorough documentation for every single patient encounter.
Every single one, no exceptions.
That's right. It means capturing all those crucial details, the patient's condition, the care you provided, and the rationale behind your interventions.
And why is that so important?
Because accurate and complete documentation is the cornerstone of quality care and effective utilization management.
It all comes back to documentation.
It really does. And how do nurse leaders work to ensure good documentation quality within their teams?
That's a good question.
Well, nurse managers often take the lead by conducting regular chart audits on their unit.
So they're doing quality control checks.
Exactly. And that allows them to see the overall quality of the documentation, identify any gaps or areas for improvement, and provide feedback to their staff.
So it's a continuous improvement process.
Absolutely. And what about the CNO? What role do they play in championing documentation quality across the entire organization?
They must have a lot on their plate.
They do, but they often take the lead on allocating resources to improve documentation processes and the tools that nurses use.
So like investing in better EHR systems.
Exactly. or providing ongoing training on documentation best practices, or even establishing mentorship programs to support nurses.
So they're creating that infrastructure and support system for good documentation practices.
Precisely. It's all about setting nurses up for success.
All right, we're on to our final category of metrics now. Communication metrics. How does effective communication fit into the world of utilization management?
Communication is absolutely crucial for making sure everything runs smoothly.
How so?
When the entire healthcare team, nurses, physicians, case managers, everyone is on the same page about a patient's status, their plan of care, and any considerations.
It just makes everything flow better.
Exactly, and that ultimately benefits the patient. Dr. Abella talks about things like team huddles and whether is a regular part of those discussions.
So making sure is on everyone's radar.
Exactly, and also how well information is being communicated during shift reports between nurses.
Ensuring that continuity of information.
Precisely. It's all about those communication loops.
So for our listeners out there on the front lines, how can you contribute to these communication metrics?
Well, as a bedside nurse, actively participating in those multidisciplinary rounds is so important.
Making your voice heard.
Exactly. And make sure you're sharing any relevant information, like the patient's progress toward their discharge goals or any potential barriers you're seeing.
So you're bringing that perspective to those discussions.
Exactly. And similarly, incorporating considerations into your shift reports is crucial.
So that next nurse is up to speed.
Precisely. It ensures that everyone is on the same page and that the patient's needs are being addressed.
It's all about teamwork and communication.
It really is. And for nurse leaders, what can they do to foster this effective communication around
Well, they're the ones setting the tone, right?
They are. A nurse manager plays a key role in establishing clear communication standards for their unit.
What kinds of standards?
Things like setting expectations for discussions during team huddles and shift reports.
So making it a regular part of the routine.
Exactly, and making sure everyone understands their role in that communication process.
It's about clarity and consistency.
Absolutely. And finally, what might the CNO do to promote this communication at a hospital-wide level?
They're the ones thinking big picture, right?
They are. They might form a hospital-wide task force or committee to develop communication standards that incorporate considerations across all departments.
So everyone is speaking the same language.
Exactly. It's about breaking down those silos and creating a unified approach.
This has been such a great into metrics. It's so clear how nurses at every level play such a crucial role in influencing these metrics and improving patient care.
Absolutely. And for those of you who want to keep learning and growing, don't forget to check out healthcarenurses.net for more resources and information.
We've got tons of materials there to support you in your nursing journey.
And remember, every data point tells a story. By becoming fluent in the language of metrics, you become an even stronger advocate for your patients and a more valuable member of your healthcare team.
You're really empowered to make a difference.
Absolutely. And what's so exciting is that these metrics aren't just numbers on a page. They reflect the quality of care we provide and how efficient our systems are.
So by engaging with these metrics, you're directly contributing to a better healthcare experience for everyone.
Exactly. It's about making a positive impact on the lives of our patients and our communities.
We hope this into metrics is giving you valuable insights and some practical tools that you can use to make a real difference in your practice.
Remember, understanding and utilizing these metrics gives you a powerful voice to advocate for your patients and for our profession.
Don't forget to visit healthcarenurses.net for even more resources and information to support you throughout your nursing career. We're here to help you thrive.
And as you go back to your practice, think about one key metric that we talked about today.
One that really resonated with you.
What's one thing you can start paying closer attention to on your unit? Even a small step towards greater awareness can have a ripple effect.
It can lead to those positive changes we all want to see.
Exactly. It's all about starting somewhere.
Thank you so much for tuning in to the Healthcare Nurses Network podcast. We appreciate you spending this time with us to deepen your understanding of this vital topic.
It's been a pleasure sharing this journey with you.
We're so glad you joined us. Until next time.
Take care.